Good day, everyone. I'm Giselle Brown.
And I'm Lesan Bullins.
And I'm Tashrina Brown.
And I'm Unico.
And our presentation will focus on cirrhosis of the liver.
This condition affects millions of people around the world and often develops silently until serious complications occur.
So in our video, we'll be focusing on the definition, the causes, the risk factor, the pathophysiology, the diagnostic investigation, the prevention of cirrhosis, and the management.
We've also included an informative breaking news segment to make learning more interactive and engaging.
So we hope you enjoy our presentation and gain a better understanding of how cirrhosis not only affects the body but our overall health.
Good evening and welcome to our special health segment. This is a breaking health alert. Cirrhosis is on the rise. Once considered a silent disease, cirrhosis has now become one of the leading causes of liver failure, cancer, and even death worldwide. Cirrhosis is a chronic liver disease in which healthy liver cells are replaced with fibrosis, scarred tissue. This change damages the liver normal structure and affects its ability to function. In today's report, we will explore the cause, how it affects the body, and how it diagnosed, and how it can be managed and prevented. The development of cirrhosis can be linked to multiple causes and risk factors. Chronic alcohol use is one of the most common causes. Over time, alcohol damages the liver cell, replacing them with fibrous tissue. Poor nutrition, especially protein deficiency, can also increase the risk. Viral infections such as hepatitis B and C attack the liver directly, leading to chronic inflammation. In some cases, right-sided heart failure causes blood to back up into the liver, leading to congestion and damage. Long-term obstruction of bile duct prevents bile flow, which injures the liver cell. Certain medication or prolonged drugs exposure can damage the liver, and sometimes the cause is unknown. This is called idiopathic cirrhosis. Now that we've looked at the causes and risk factors, let's turn to how cirrhosis actually shows itself in patients. The disease is often associated with a wide range of clinical manifestations. Patients may present with hepatomegaly and an enlarged liver and experience rapid weight loss as the disease progresses. They often report persistent weakness and fatigue, which can interfere with daily activities. Many develop jaundice, a yellow discoloration of the eye, and skin that signal impaired liver function. Others may complain of abdominal discomfort or pain located in the right upper quadrant, the region where the liver is located. No matter the cause, the result is the same: reversible scarring that changes the liver forever. But what really happened inside the body when the cirrhosis develops? To help us understand the science behind it, we now turn to our health analyst, Dr. Brown, who will explain the pathophysiology.
Thank you, Lesan. In an healthy liver, blood flows freely through organized lobules. The liver filters toxin, metabolizes nutrients, and produces proteins and bile. In cirrhosis, liver cells die, a process called necrosis. These dead cells are replaced by fibrous connective tissues known as fibrosis. Over time, regenerating cells form nodules surrounded by scar tissues, destroying the normal structure. This scarring causes portal hypertension, which is high blood pressure in the portal vein. Blood flow through the liver becomes blocked, causing backup and congestion. As pressure builds, the spleen enlarges, and fragile veins in the esophagus and stomach develop, which may rupture and bleed. To compensate for poor circulation, the body activates the renin-angiotensin-aldosterone system, which makes the kidney retain sodium and water. This leads to ascites, fluid collecting in the abdomen. When blood flow to the kidney decreases, hepatorenal syndrome develops. This means the kidneys look normal but cannot function properly. The liver's loss of function also leads to hepatocellular failure, causing accumulation of ammonia, which causes confusion and altered mental status. Decreased protein clotting factors production, which leads to bleeding and bruising easily. Reduced bile production, which causes poor fat digestion and jaundice, and also hormonal imbalance. Cirrhosis therefore affects not just the liver but also the circulatory, renal, nervous, and endocrine system. To show how cirrhosis is diagnosed and confirmed, let's hand over to my colleague Dr. Cole for a look at the key medical investigation.
So thank you, Dr. Bell. So to confirm a diagnosis of cirrhosis, a combination of medical history, physical examination, imaging, laboratory testing, and biopsy is used. First, we begin with a thorough medical history and physical examination. We look for risk factors such as chronic excessive alcohol usage, obesity, and autoimmune hepatitis. So on examination, we may find signs like jaundice, ascites, and splenomegaly. So recognizing these early is key for detection before irreversible damage occurs. Next, we move to imaging testing. Magnetic resonance electrography (MRE) measures the stiffness of the liver. The stiffer it is, the more fibrosis present. However, results may be less accurate in patients with obesity or large volumes of ascites. Ultrasound is a safe, non-invasive tool that shows the shape of the liver and detects fluid or tumor. The CT scan provides detailed cross-sectional views, excellent for identifying hepatocellular carcinoma and advanced complications. MRI gives a high-resolution image of liver structure with radiation, especially useful for confirming cancer. Then we check the hematological markers. A low platelet count below 150 times 10 to the 9th per liter is often the earliest sign. This happens when the spleen enlarges and traps platelets due to the increased portal pressure. Finally, a liver biopsy confirms the diagnosis and identifies the cause. It is usually done through the skin under ultrasound guidance, but for patients at risk of bleeding and transjugular biopsy through the veins is safer. This step provides the most accurate picture of how much fibrosis is present. Combining these investigations, clinicians and confirm cirrhosis, monitor progression, and guide management. For more on how cirrhosis is treated and controlled, we now turn to Dr. Brown.
Thank you, Dr. Cole. Alright, so cirrhosis is a progressive and irreversible scarring of the liver. Management focuses on slowing progression, preventing complication, and improving quality of life. Treat the cause. For alcohol-related cirrhosis, complete abstinence is vital. For hepatitis B or C, antiviral therapy can stop the virus and protect remaining liver cells. Patients with non-alcoholic fatty liver disease must adopt weight loss and metabolic control. Autoimmune hepatitis or genetic conditions such as hemochromatosis should be treated early to slow fibrosis. Nutrition is a key component. A nutrient-rich, high-protein diet prevents muscle wasting. Protein restriction is no longer advised. However, for those with ascites, sodium intake must be restricted to reduce fluid retention. Vaccinations for hepatitis A and B, influenza, and pneumococcus are also essential. Equally important, avoid hepatotoxic medications. So drugs like non-steroidal anti-inflammatory drugs can worsen bleeding or kidney injury. Patients should consult their care team before using any over-the-counter or herbal remedies. Ongoing surveillance is crucial. Patients should have regular liver function tests, clotting profiles, and kidney assessment. Screening for hepatocellular carcinoma is done every 6 months using ultrasound with or without alpha-fetoprotein blood test. We also recommend endoscopic screening for esophageal varices in anyone with portal hypertension. The specific complications are managed as follows: ascites, salt restriction diuretics, spirolactone, fructosamide, or large volume paracentesis. Discal bleeding prevented with non-selective beta blockers or treated with endoscopic band ligation. If refractory, a TIP procedure may be used. Hepatic encephalopathy identifies triggers, reduce ammonia with lactulose and rifaximin. Spontaneous bacterial peritonitis, SBP, immediate antibiotics, and possible long-term prophylaxis for high-risk patients. For advanced and decompensated cirrhosis, liver transplantation is the only curative option. Candidates are selected using the model for end-stage liver disease score. Transplantation dramatically improves survival and quality of life. By combining cause-specific therapy, lifestyle support, monitoring, and surgical options, we can extend life and preserve function even after a diagnosis of cirrhosis.
We have just explored cirrhosis, its definition, causes, risk factors, management, and how it affects the body. But what happens next? When the camera turns off and real care begins, let's step into the hospital to see how nurses, doctor, and dietitian support a patient living with cirrhosis, and how interventions are used to manage its complications. Good afternoon. I am Nurse Bullins and I'm going to be your nurse for the shift. What's your name?
My name is Giselle Brown.
Can I see your armband, please? Okay. Mrs. Brown, how are you feeling today?
Honestly, I'm feeling a bit tired. My stomach is swollen and my legs are puffy.
Okay, I understand. Today we'll check your vital sign, measure your fluid, input and output, and review your care plan for cirrhosis. Let's start with your vital sign, okay? Alright, I'm gonna put this thermometer on their arm. It is gonna stay for about 3 minutes. Then I'm gonna do your blood pressure. It's gonna feel a little elevated and not gonna harm you. Okay. Alright, Mrs. Brown, I'm gonna check your arm if it is dry, okay? Put the thermometer. Put it in your hand. Alright. I'm gonna assess your abdomen. Is that okay?
Yes, it's okay.
Is it involved for me to touch you? Is that okay?
Yes, you have my
to harm you.
permission.
Nothing to harm you.
Okay. I hope so.
Mrs. Brown, you empty your bladder before?
Yes, I did.
Okay. Alright. So I'm gonna look at your belly, inspect it. Now, your charts show fluid buildup in your abdomen called ascites. We will measure your abdomen daily and track your urine and drinking to help to see if your diuretics are working and preventing fluid overload.
So all of this swelling is because of my liver?
Yes, scarcity in your liver shows blood flow, increased pressure in the portal vein, and your body holds into extra fluids. That's why we carefully monitor your intake and output. Okay, Mrs. Brown, I'll get the doctor for you.
Okay. So good morning, Miss Brown. I want to go over your liver status with you. So, based on what I'm seeing here, the scar tissues has developed, which caused the fluid buildup, the varices, and other complications. So your nurse is monitoring you closely, which is excellent. So that's why I feel so weak and bloated all the time. Well, exactly. So we'll manage the medication. We're giving you medication like diuretics, beta blockers, and lactose if needed, and we'll monitor your labs regularly. So Miss Brown, I will now get your dietitian to go over the facts with you. Okay.
Alright, so hello Mrs. Brown, I am your dietitian for today. Alright, so I am here to talk about nutrition. Your nutrition. So nutrition is very important in managing cirrhosis. Alright, we recommend small frequent meals, high in protein to prevent muscle wasting and limiting salt and control fluid retention.
So I can eat protein even though I'm sick?
Yes, protein is essential unless contraindicated. So we balance it with sodium restriction, foods like lean meat, eggs, legumes, and low salt vegetables are excellent. So here's an example plate for you. Okay, Mrs. Brown, that's it for today. I'm going to hand over back to your nurse so that she can finish explaining to you, okay?
Okay.
All right, take it easy, all right?
I'll try.
Mrs. Brown, following this diet can help prevent muscle wasting and support your liver recovery. We will also reinforce during daily care. Cirrhosis reduce clotting factors, so you may be bruised or easily bleed. We check for bruises, bleeding gum, and black stool daily. Your immune system is weaker, so we use sterile techniques for procedure and monitor your temperature and blood tests closely.
Okay.
Fluid in your abdomen can be pressed on your lungs. Sitting upright during deep breathing exercise help you breathe better.
Like this?
Right.
Okay.
Cirrhosis is more than medication. Avoid alcohol, follow your diet, take medicine on time, and attend follow-ups.
I want to do everything I can to protect my liver.
Right, that's the game. Great. Can you tell me what you'll be doing at home?
I'll avoid alcohol and I'll stick to my diet plan.
Don't forget vaccinations like hepatitis A, B, the flu vaccine, and also pneumococcus. And avoid self-medicating with harmful drugs or herbs. Your nutrition and lifestyle choices work alongside your medication to protect your liver.
Okay.
You're not alone, Mrs. Brown. We work as a team, nurses, doctor, and dietitian, to monitor your condition and complications.
As we know, early detection and teamwork are essential to slow the disease progression and maintain quality of life.
Nutrition and daily monitoring are just as important as medication. Together, we help maintain your health.
Knowing I have a team to support me makes it much better.
Remember, cirrhosis is manageable with the right care, education, and lifestyle changes. Regular monitoring, health habits, and teamwork make all the difference.
Thank you. I feel more confident about taking care of myself now.
Yes, we are encouraging you to avoid alcohol and limit its intake.
Get vaccinated against hepatitis B or C.
Eat a balanced diet and reduce salt intake.
Avoid self-medicating with harmful drugs or herb, and always attend your follow-ups and lab checks.